is in London and joins us for more on this. OK, Nicola, so it seemed inevitable that this lockdown was going to come. How have health officials and scientists reacted to the news the government has finally made this decision?
Well, they're pleased that they finally made this decision, but your word there, Kamali, finally is an important one. They've been calling for this since before Christmas, really. They told the government to cancel Christmas. They said straight away that we needed much more stringent measures put in place. But it seems that it's been a very slow progress before the government has finally given in to these demands and has called for this national lockdown. Now, parts of England, certainly here in London where I'm based, have been in so-called Tier 4, which was restrictive. It meant various things that you weren't allowed to do, loads of shops closed, businesses closed, things like that. But I think it's partly because of this confusion with the tier system meant that not only did you have lots of flagrant disregarding of the rules by large groups of people, but also a lot of people just weren't sure what they could and couldn't do, and they believe that that probably has had a major impact on the spread of the virus, as has the new variant. Now, the government has said it's because of this new variant of the virus, which it's been shown to be 50 to 70% more transmissible than the original, can I say that? The original COVID-19 virus. They're saying that's what's causing the dramatic increase in numbers, and these numbers are horrifying. We are at the moment at 40% higher hospital admissions than there were in April, the peak of the pandemic last year. The actual figures here yesterday, 26,626 COVID patients in hospital in England. Now, it's the doctors and the scientists are saying really it's because we need to change behaviour, and that's why they were calling for this lockdown. They were saying that children needed to be kept at home, people shouldn't be going out, they shouldn't be congregating in any groups other than within your household bubble. And now finally, that's what Boris Johnson announced at 8 o'clock last night. So we are back in this national lockdown.
Yeah, perhaps at the right time too. Just, Nicola, take us through why you think there was such back and forth over the opening of schools. Of course, most schools will be open for key workers' children. That's important to point out. But why this back and forth in the UK about whether schools should stay open or stay closed?
Well, the main reason, of course, is because of the disruption to children's education, and a lot of experts have said it's really important, if you can, to keep children in school. Also, you have to think of children who live in very hard, very difficult circumstances, perhaps in dangerous circumstances, and being out of those family homes is probably better for them. And of course, you have got many, many children who don't have access to online learning, so their education will be completely disrupted. But it is known that this new variant of the virus does affect children. They don't know why that's the case. There's discussion whether it's something to do with the ACE receptor, whether that has some sort of impact, but it's known that children seem to get it. I was speaking to Professor Paul Hunter just a couple of days ago, and he said the 10 to 14-year-olds are those who are spreading this virus the most. I have to say, I keep repeating personal information, but anybody living in London is affected by this virus. They've either had to get tested for it, they've had it, or they know somebody who's had it. I know many friends of mine who have been sick over the Christmas period because their school-aged children brought the virus into the home. They themselves were only marginally ill, but they tested positive, and their parents then came down with quite a severe dose of COVID-19. And that's probably the main reason why Boris Johnson has finally given in to the demands and has created this national lockdown and told schools that they have to stay closed till at least the February half term.
OK, well, Nicola Hill there, our health correspondent in London, thank you very much for that update.